Okay, good afternoon, everyone. I am Pam Andrus, and I want to welcome you to a joint program between CompleteRx and the Kentucky Center for Performance Excellence. Today's program will focus on the strategic planning process for creating and living a culture of excellence with the integration of Baldrige methodology and then review of previous award-winning applications. All participants will be on mute, but we encourage you to submit your questions using the Q&A feature on your screen. And there's also a couple of poll questions throughout today's discussion, so we appreciate everyone's participation with those as well. I want to get started by introducing our speaker. Mr. Ken Maxick is the Director of Patient Safety and Pharmacy Compliance for CompleteRx. He brings over 20 years of hospital operations, management consulting, and healthcare executive experience to the firm. He is a certified master black belt in Lean Six Sigma, an ISO 9001 provisional auditor, a senior member of the American Society for Quality, and a fellow in the American College of Healthcare Executives. He's also a member of the executive committee for the Kentucky Association for Healthcare Quality and then president-elect of the board of directors for the Kentucky Center for Performance Excellence. And with that, I'm going to turn it over to Mr. Ken Maxick.
Thank you, Pam. Appreciate it. Wanted to quickly just go through what our learning objectives were for today. And we want to look at basically the Baldrige criteria and understand how organizations have used these criteria in order to develop and implement their strategic plans. I wanted to start out by giving a little background on what is the Baldrige Enterprise, as it is more diverse than many people realize. Forming the base of the enterprise is the Baldrige Foundation, which is the fundraising arm. As many of you are aware, back in 2012, Baldrige lost its public funding as part of the federal budget cuts. The Alliance for Performance Excellence is made up of the state programs that utilize the Baldrige Performance Excellence criteria to recognize state award recipients. Top award recipients at the state level are eligible to apply to the National Award Program. The Kentucky Center for Performance Excellence is the Alliance member for the Commonwealth of Kentucky, and I know many of you on the webinar today are either applicants, members, or examiners of the Kentucky program. Document management, along with application submission and distribution, is done through the American Society for Quality. And anyone interested in purchasing a Baldrige criteria book can do so through ASQ. However, please note that the American Hospital Association had sent criteria books to all of their member facilities, so you may already have an older version. And then there is the national program, the Baldrige Performance Excellence Program, that develops the criteria for the national award process. And this year there is a new criteria book with the representative changes. The healthcare version just happens that it was released last week, so you can now contact ASQ if you'd like and get a new version of this book. The framework of excellence is built upon core values and concepts with the boundaries of your organizational profile. The organizational profile is a snapshot of your organization, the key influences on how it operates, and your competitive environment. The criteria are broken down into 7 categories. 6 of these categories are process categories, and the 7th is the results category. Starting with the leadership triad on the left-hand side of the slide is comprised of leadership, strategy, and customers. Today we are going to focus on category 2, which is strategic planning. Strategic planning is subdivided into strategy development and implementation. So let's take a look at what we did here. The methodology for this program was to review the award-winning applications from all healthcare award winners from 2010 to 2015. Note, this is not a sample, but a review of all award-winning application summaries as available public information from the NIST site listed on this slide. So any of you can go to the website and download these award-winning application summaries. You look at your specific sector and download those award winners that you want to look at. We then compared the process items related to strategic planning to obtain a consistent review of the strategic planning and implementation process. Included in this presentation is also areas that individual facilities conducted are part of their planning process. Some of the forms used in this program did not come from the award winners, but are a visual representation to show how you may choose to go about implementing the concepts and ideas that we have covered here. Remember, as we're going through this program, that the performance excellence criteria ask you, the organization, to answer the question. The scope of the answer depends on what your organization's scope is and current and anticipated market conditions. So let's get started by looking at how these organizations develop their strategies. I wanted to also note that while this presentation will focus on healthcare award winners, we'll be looking to understand what the process was that they followed in order to obtain their results. Process steps can be amended to suit your size, scope, and sector of your organization. And in many cases, the steps may be the same regardless of sector. For example, we'll talk about conducting a regulatory assessment. While the specific regulatory agency may change, the concept of conducting a regulatory assessment would be universal. But first, we have a quick question to ask you.
All right, so here's our first poll question, and it's how effective do you perceive your current strategic planning process to be? A, very effective, B, effective, C, somewhat effective, and D, asks the question, what's a planning process? Give just a couple of minutes to get the poll questions answered. All right, we'll go ahead and close the poll then. And pretty convincing here that C, somewhat effective, which is about 60% of those that responded, and then 27% said effective, 13% very effective, and we didn't have any, Kim, that asked what exactly is the planning process, so that's really good news.
Thanks, Pam. Yes, and that's what we're used to seeing, that there certainly is a vast majority of individuals that certainly show that there is room for improvement in their process. And when you look at what we're going to look at now, which is the category 2.1 of the Baldrige planning, strategic planning, it shows you how to do your strategy development. And so we're going to discuss that today, but we're going to discuss it in two sections. The first section is the strategic planning process. And I want to make this clear. This is not your strategic plan. Your strategic plan is one of the outputs of your strategic planning process. So let's first of all look and talk a little bit about what is a process. Okay, so all processes have inputs, and we'll review the inputs that these award winners have used in their process. Process also has defined outputs, one of which in this case, as I mentioned, is your strategic plan. Other outputs could include an understanding of your core competencies, what your strategic advantages and strategic challenges are, your vision or revision of your vision, your mission, and your values, among others. All processes have customers, and the customer receives the output of your process. Remember that because many of us work in the service sector, that your customer can also be one of your suppliers of inputs. So in the healthcare sector, your patient as the customer provides you with information about their health. For example, if they're diabetic, they could inform you of how their blood glucose has varied over the past month. The suppliers provide inputs to the process, and we can, for the purposes of strategic planning, not only consider these as suppliers, but also think of these as our various stakeholders. And an important feature is that a process can be measured. If you think of it, the process can be measured at the input, the process level, or the output level. And finally, if we can measure it, then we can improve it. So let's look at some standard definitions so that we're all talking about the same thing. Your processes are the methods your organization uses to accomplish its work. The framework for performance excellence will help us in assessing how good our process is along 4 different dimensions. The first being, what is your approach, which is designing and selecting effective processes, methods, and measures. The second is deployment, implementing your approach consistently across your organization. The third step is learning, which is assessing your progress and capturing new knowledge, including looking for opportunities for improvement and innovation. And then fourth, finally, for mature organizations, is integration. This is where you align your approach with your organization's needs, ensuring that your measures, information, and improvement systems complement each other across processes and work units, and harmonizing processes and operations across your organization to achieve key organization-wide goals. For a graphical view of the strategic planning process, I can summarize it as a cause and effect diagram. Now, I know this slide is a little difficult to read, and at the end of this webinar, we will explain how to obtain documents associated and used during this webinar. But the point the slides bring up is that strategic plan development is the process by which you develop your strategic plan. And that is why the use of the cause and effect diagram works well. If you supply the needed inputs or causes, which is on the left-hand side of this diagram, then you will end up with an effect of having a consistent method to obtain your strategic plan. Once again, remember, the boundaries of your planning is a result from putting together your organizational profile. On the following slides, we'll go through some of these input categories and show how questions may be responded to. Key process steps have included a review of mission, vision, values, and core competencies. Gather and assess stakeholder feedback, review organizational sustainability and what may be occurring in the short term or foreseeable events that could impact long-term sustainability. A step taken by all is a well-developed environmental analysis. Progress that has made toward completing previous strategic objectives, development of long-term and short-term goals, goal and action plan communication, analysis of ongoing performance improvement initiatives, and opportunities for innovation. As an organization, you'll need to determine your specific steps. However, these can serve as an initial review to guide you. As part of the plan, we need to make sure that we have the correct people or groups in the room in order to develop a well-rounded plan. Key participants in the process for healthcare could include senior leaders, physician clinical directors, key partners, board members, medical staff officers, physician group practices if you operate in any physician groups, nursing councils, things like residents if you happen to be a teaching facility, and you of course want to include your patients, your communities, payers, and then some will also include some external experts, partners, and certainly should include members of your workforce. As you can see, casting a large net to gather many perspectives as input to the plan, either through survey instruments, satisfaction, dissatisfaction surveys, or partner performance reviews, provide a robust and diverse ability to understand the current operating environment. Short-term planning represented what the organizations were going to accomplish this year, while the longer-term planning horizon varied between this group from anywhere to 3 to 5 years. As you can imagine, when an organization is looking out to their crystal ball and trying to determine what may occur 3 or even 5 years later, the plan becomes more susceptible to variation. And the organization must be prepared to deal with the inherent variation. So, how do you address this? Through conducting regular reviews of performance combined with ongoing environmental analysis to allow the ability to prioritize change initiatives and allow for organizational agility and operational flexibility. Environmental analysis would include areas such as competitive volumes and benchmarks, projected demand for services, technological innovation and understanding the disruptive ability of this type of innovation and the tracking of performance dashboards. Reviews of the measurement in some cases is done monthly and in other areas on a quarterly basis. What is included in the process is the use of scenario planning as part of the environmental analysis. So they'll look at trends such as the movement from the inpatient setting to the outpatient setting and determine what the impact is on the organization if the trend remains the same course, if the trend increases, or if the trend declines. So you now have 3 different scenarios to test various hypotheses. Then review the impact on the organization of all 3 variations and what the response would be if that scenario occurred. In this manner, they have already taken a step toward identifying an area where change may be needed and the initial actions that would need to occur under those circumstances. So what they've done is they look at the changes in the environment and can address what would happen in terms of operational costs and possible changes in reimbursement and changes, therefore, to the overall revenue stream for the organization. So let's look at having a robust measurement system is required. And some of the areas for review are stakeholder voice of the customer, looking at the CMS and value-based purchasing, workforce engagement, some measurement of your safety climate, information provided by a physician liaison or other manner to obtain measurement from the medical staff. We spoke a little bit about conducting environmental scans. You'll need to include community needs assessments, although the community needs assessment might not need to be done every year. You want to look to people and organizations that you collaborate with. What are the issues or concerns that they see? And are there areas for partnering? Include competitor intelligence, technology, and overall facility assessment, along with a service line assessment. These relevant data utilizes inputs to the strategic planning process, may include risks to future success. What gaps are being seen in the current data related to product or service delivery? As we all know, healthcare is a changing environment, and it comes as no surprise that these organizations monitor the environment for potential changes to regulations, potential areas that were overlooked by the strategic planning process, and the organization's ability to execute plan. Now, all of these organizations utilized some type of a SWOT analysis, strengths, weaknesses, opportunities, and threats. The use of a SWOT analysis aids in detecting strategic challenges and strategic advantages. The area to discuss is who is involved in creating the SWOT analysis, and here there is a mixture of people and organizations. Consider inviting individuals from both your primary and secondary markets, physicians, employees, and even foundation board members. Also consider how you can get the workforce involved in the process through soliciting input via a survey instrument to obtain strategic and tactical thinking. Remember, if your organization has 100 or even 1,000 employees, that drastically increases your notion of the information that is available. Now remember, you can also segment your SWOT by key groups. So you can develop a SWOT for just the community, or a separate SWOT analysis for your medical staff, or other key stakeholders that you want to include in your process. Risks to future success in healthcare, especially over the past 8 years and through 2017, revolve around potential changes to the regulatory environment, potential blind spots of the strategic planning process, and the organization's ability to execute plan. The gap between the intended results and those that the organization is attaining, especially when compared or benchmarked against the competitors. Other areas to monitor would include technology scans, market analysis, healthcare services on the national, state, and local levels. Patient and stakeholder preferences can be obtained through the use of patient satisfaction surveys. Look at what your competition is doing as part of your overall market assessment. Be sure to review the economy on the national, state, local levels and understand how these could impact your organization, and also include potential innovation, including what areas you may be able to innovate as far as what your innovation inventory is, and a gap assessment of what you have compared to what may be coming down the line. What would happen, for example, if robotic surgery replaced the need for current surgeons? To understand the potential impact of the regulatory environment, organizations can conduct both internal and external gap analysis, audits, and mock surveys. Results from these reviews enter into the strategic implementation phase of the process, and we'll be discussing that very shortly. By monitoring the regulatory environment, healthcare organizations are able to better understand what future reimbursement may be and the areas of focus for such organizations as the Office of the Inspector General and the Centers for Medicare and Medicaid Services. At this point, everyone should consider the impact of the Affordable Care Act being repealed. And as you can imagine, this would include multiple scenarios that would impact the healthcare sector. I like the analogy of the newer cars that now either flash a signal light or have some sort of beep, or possibly even both, to warn the driver that there's a vehicle or object that is in a blind spot of their car. This is true because our best plans will have blind spots associated with them. And so the goal is to mitigate the risk from these blind spots and put out some measures for identifying what they may be. So what are some of the areas that can be monitored to provide us with an early warning sign that something is changing or something that we had not considered is happening? We need to review the current marketplace, and there is something that is disrupting the market. What is occurring with inpatient and outpatient service demands? Are there any potential new entrants into the market? Can we obtain industry intelligence? What are our current gaps in key support processes and also performance gaps in areas related to our core competency? In addition, this is an area where information obtained from key collaborators can be used, as their core competency may allow our organization to enhance its vision. This is also an area where the use of scenario planning can come into effect, so you can see how the various linkages are falling into place in the strategic planning process here. Our organizations cannot have every work process as an internal core competency. And there are times when we need to seek outside assistance for a work process that is part of a partner or potential partner core competency. In these cases, we need to have a defined approach for selecting and measuring partner performance. These organizations have looked for partners that are compatible with the organization's values, have a mechanism to ensure that outcomes, either patient care or supportive services, would capitalize on the partner's core competency, and that the partner core competency will provide an advantage to the host organization in their marketplace and service delivery. The standardized approach includes the use of a developed matrix that they use to move through the process of partner selection after reviewing their own core competencies. This matrix looks through the internal capability and capacity and external factors, with the goal being to enhance the organization's strategic advantage. Here, these organizations have aligned future core competencies by taking what the strategic planning process identified as a strategic objective. This strategic objective is then analyzed to determine the resources needed in order to obtain that individual objective. So, for example, if that objective required a new or advanced competency to enhance either workforce capability or capacity, then this change to workforce gets included in the next strategic planning process iteration. This would include the associated goals and measurements along with the timelines for completion. As you may expect from this group of Baldrige Award winners, all of their key strategic objectives are what would be considered lofty objectives to other organizations. Things such as best places to receive patient care or remarkable community value, best places to work, best places to practice medicine, best place to learn, best places to refer patients, and reshape healthcare were all included as part of these organizations' key objectives. And when you review their applications, you notice that all of them monitor the inputs to these objectives and benchmark, and their benchmarks are all with top decile or exceed competitor growth or world-class comparisons, and they all use various external sources to get their benchmark information. In their applications, you could see how they look to find different sources that allow them to benchmark their results. However, all organizations operate under some degree of resource constraints, and the organization needs to obtain a balance amongst the competing organizational needs. This can be accomplished through a review to determine organizational capability and capacity for goal accomplishment, utilizing what they refer to as intelligent risk criteria. Others strike a balance through the use of various large objective pillars to consider and balance the needs of the various stakeholders, while others still employ a balanced scorecard approach. Several tools are available to aid in selecting various projects, and one tool looks to identify the project. And then after the project is identified, determine how it will align with your organization's strategic objectives. So does the project have a champion, or is it aligned with one of the organization's core competencies? At this point, you would then look to the overall financial resource requirements. That is both the dollar amount and the workforce requirements, and what your current workforce capacity is to determine what the organization's ability is to complete the project. With all of these items in place, a score is given to the project by the team. The group can then look at each one of the strategic objectives and balance the projects based upon an overall objective impact. In this manner, resources can be optimized for the organization. So we have our strategic plan, and the next step is to move from the plan to looking at how these organizations develop their strategic implementation. We need to understand how to turn strategies and plans into actions in order to accomplish strategic objectives and goals. As you'll note, we could have developed the absolute best strategic plan. However, if all it does is sit on a shelf not to be looked at until next year, or if resources are not thought about in order to implement the plan, then our chances of success are drastically reduced. So implementing your strategic plan is as important as the associated strategy. Let's look at another question to see how your organizations are doing.
And Ken, we know based off the first poll question that all participants do have a strategic planning process, but here we're wanting to find out what percent of your 2016 strategic objectives did you complete in the 2016 plan year? A would be less than or equal to 25%, B is 26 to 50, C is 51 to 75%, D 76 to 90, and then we've got the 91 to 100% as answer E. Okay, we'll go ahead and close out the poll. And you should be able to see the results on the screen, but it looks like we've got the highest percentage in the 51 to 75%, and then followed by the 76 to 90% in terms of actually achieving your strategic objectives, which is a really good response.
Well, yes, absolutely. And to those of you that achieved 76 to 90%, congratulations. It seems to me that most of the time what happens is we almost bite off a little bit more than we could chew and wind up in the 50 to 75% range when we're talking about achieving a one-year plan. So, well, in strategy implementation, we're going to discuss action plan development and deployment and the pieces that need to be in place in order to assist you on your journey. There are many templates that can be used, and the goal in each case is to have a systematic mechanism to fully deploy your strategic plan throughout the organization. This form is being presented strictly as an example, and you could use something along this line or another format if it fits your organization. In this template, you would start at the left-hand side of the document and enter your organization's strategic objectives. Next, along the top, you would list the long-term goals, and through the use of a colored link them with your key measures and then associated action plans. Then for each of these goals, you would have measurement and then cascade from the organizational measurement to each departmental measurement, which would then go onto additional tabs in this file. Action plans are set based upon what we want to accomplish this year and combine to allow for achievement of longer-term plans. So these plans need to go from short-term action plans cascaded down to departmental action plans as the action needed to take for the year to bring us in line and allow us to obtain that 3 to 5 year strategic objective. And the way things have been done in these organizations is by assigning a responsible party to each of the strategic objectives. This is a senior leader, and by assigning the initiative in this manner, the senior leader acts as a service line leader to allow them to break down potential organizational silos and barriers. This allows for an integration of the strategic objectives. To have the plan remain on track, there are assigned target dates for items to be completed, in some cases monthly and in others quarterly. And one of the organizations actually had items reviewed on a weekly basis. Each of these senior leaders then works with the department manager who has an impact on the strategic objective. In this manner, the strategic objective is cascaded to employees and included in the individual performance plans. These organizations maintain communication plans that they implement to partners and collaborators, allowing these groups to participate in obtaining the objectives that they sought to create. This is how the implementation plan then ties back to the strategic plan, as these same partners act as a source to provide information back to the organization. So it almost acts as a closed loop within the strategic planning process in the development phase and in the implementation phase. What is noticed with these organizations is how they have aligned the strategic planning process, their budget process. The budget cycle is following the strategic planning process, and this would include the annual budget, capital, workforce, medical staff, and information technology. So they schedule their strategic planning process ahead of when the budgets are due to be submitted. In this manner, the strategic plan is approved, so when all of the departments begin to prepare to go into the budget cycle, they already know from the plan where the changes and emphasis will be occurring from previous years. This allows them to assure that resource allocation will be able to be obtained under their current environmental conditions. By having all of these areas in alignment, resource allocation and the optimization of scarce resources can be agreed upon. With changes in the strategic objectives agreed upon, the organization needs to review how this will impact the workforce both in the near term and further out. So a review is conducted to address workforce resource needs based upon the selected strategic objectives and determine productivity targets to get an understanding of the workforce capacity. For example, a strategic objective to implement a new service line may require the organization to review a succession planning process, redesign policy and procedure, and understand and review workforce capability. Answer the question, how will this change the skill mixes of the staff based upon benchmark historical performance and workload forecast tools that you have available to you? Action plans can be built around staff recruitment and retention, segmented by the various workforce groups. All of these organizations have some format for moving from goals to a dashboard with multiple items required to meet the goal that include benchmarks for each. These then have an alignment with these strategic objectives, action plans, and performance review. In the overall cascade, they show the links between what the strategic objective is and then drill down to the individual action plans. The data collection includes both real-time data, such as staff attendance and productivity metrics compared with goals, and also includes retrospective data, such as how the organization did based on results of their various HCAP scores. They review performance goals and identify gaps between current levels and projected levels and trends. Inputs utilized include customer satisfaction and also customer complaints. Performance projections are based upon any gap between obtained and expected and compared to a selection of benchmarks and levels of performance. Some may be compared to externally established standards such as value-based purchasing. Benchmarking studies or comparative data are also made available to all of these organizations. You also see comparisons between their current performance versus what they projected their performance to be and what they project their performance of their competitors will be in the marketplace. As a side note, when you're looking at who to benchmark with, compare your benchmark to your organization's mission and vision to see if they are in alignment. If the goal of the organization is to be a world-class provider of service, then your benchmark should reflect that and not be compared to the 50th percentile. The establishment of your goals should be designed to bring you into that direction. Well, I'd like to conclude this presentation with this quote from Rulon Stacy, the former CEO of Baldrige Valley Health System, as it represents the reason for being on this journey. We have discussed creating a strategic planning process using multiple inputs to the process with a large amount of inputs from various stakeholders. Taking the plan and communicating it throughout the organization so that all employees, collaborators, and partners understand the plan. Then we discussed how to implement the plan and drive improvement through involvement, goal setting, measurement, and benchmarking. And with that, we'll open up the lines for any questions.
All right, thank you, Ken. Before we move on to Q&A, both organizations, CompleteRx and KyCPE, want to thank you all for your participation today. There's going to be a very quick 2-question survey at the conclusion of the program. We thank you in advance for completing that survey and providing your feedback. And then we also want to mention here that a link to the recorded webinar will be emailed to all attendees for you to view at your convenience. Okay, so we're going to move on to some questions. Ken, one of the first questions that came across is, can you provide some more details to the inputs organizations will use in the strategic planning process?
Yes, I can. One of the things that really stood out in going through these various organizations is how many inputs they used in their process. It was really something. Some of them broke down into various categories such as technology, and they did overall technology scans, not just within their organizations, but also what the technology availability was for their suppliers and their partners. And they also looked in terms of what sort of disruptive technologies may be coming along. You know, the healthcare industry, we're looking at how meaningful use, both on the inpatient side and in the outpatient side, is going to impact us. They looked at their overall markets. What was their current market share? And they compared that to their key competitors. They would look at inputs such as what are their current healthcare services? What is their community needs through doing a community needs assessment? What sort of community support is available in their area? And what comparative data was available to them? What you saw a lot going on is a lot of surveys being used. I mentioned before that one of them actually used surveys of their employees to try and see what sort of new technology could be occurring. You see them also using surveys of their patients and complaints of their patients, surveys of their medical staff. Once again, trying to cast that large net to get inputs. And probably no surprise, you always have to look at the economy. What is occurring on the national, state, and local measures? And finally, the thing that they all looked at was what is their ability to innovate new services and what could be innovations that are occurring that could have an impact on their business. So those are some of the inputs. As I said, if you look at it, really, there were extensive amounts of input that they all used in their strategic planning development.
And the next question is specific to the implementation process. So this is a question about your review of the previous award winners. Was there something specific that stuck out as you reviewed all of those award-winning applications?
Yeah, what really stuck out to me is how they cascaded their actual implementation plan. Because remember, some of these organizations were very large health systems. So their strategic plan implementation really went from some global corporate system strategic objective that then went down to the individual hospital or individual ambulatory surgery center that had to have then a key champion within the organization, that key champion then got the department managers on board, and they literally had cascaded it all the way from this high system level view to actually put the strategic objective in some form into their employees' goals for the year. And that's why when I say, you know, it's interesting to see that some of these organizations actually, when they looked at goal achievement, were actually evaluating how they were moving the needle on a weekly basis. So you could see how they just drilled that through the entire organization.
Okay, thank you. This is specific to the applying for the Baldrige Award, and the question is, if I'm interested in applying through KyCPE, how do I go about doing that?
Well, there's two ways. First of all, KyCPE is the state alliance member for the Commonwealth that utilizes the performance excellence framework that we also frequently call the Baldrige to give out the state awards. And there's really two ways you could do it. One, you could go on to the KyCPE website, which is kycpe.org, and all of the application information is on their website right there. Or the other thing you could do is send an email to info@kycpe.org, and someone will then just answer your question and send back any of the required documents or information that you're requesting.
Okay, thank you. And we have both of those listed here on the slide that all of the participants are looking at right now. The final question was, and I'll answer this one, Ken, how do I get a copy of the cause and effect diagram? Again, we will be sending out a link to today's recorded webinar to all participants. And then if you have any specific questions, you can certainly email through any of these emails that are listed here on the final sheet that you're looking at on the summary slide. And with that, we're going to go ahead and conclude our program. Thank you again, Ken Maxick, for all the information and for your review of all those previous award winners. And we want to thank KyCPE for partnering with CompleterX and delivering this webinar. Hope everyone has a wonderful afternoon, and we'll sign off. That was good. You did a good job.